Welcome back. The Clinical Diabetes Center at Montefiore provides comprehensive care for adults with diabetes. Their goal is to teach and empower patients to improve their health. Joining us now to raise awareness and discuss diabetes technology to reduce complications, reduce the burden of living with diabetes, and improve quality of life and more is Michael Greenberg, nurse practitioner at Montefiore Health System. Welcome, Michael. Thank you so much for joining us today.
Thank you very much. I do appreciate it.
Of course. Just to start off, let's backtrack. Let's start with the introduction. So can you help us define what diabetes is, what the different types of diabetes are, and how they're caused?
Absolutely. So before I even say, well, what is diabetes? Whenever we eat anything with carbohydrates, that's your body getting fuel. So the simplest and most efficient way to fuel your body, to give it energy, is through carbohydrates. Carbohydrates are broken down into sugar, and you need to effectively use insulin to move the sugar into your body's cells. So in diabetes, whether it's type 2, which is more common, or type 1, there are defects in the body that either have insulin resistance or insulin deficiency. So both of which ultimately leave the person with diabetes with high blood sugar levels that can damage blood vessels. In type 2 diabetes, there's a lot of, I guess, lifestyle issues that go along with it. There's also a genetic predisposition to it. Type 1 diabetes is a rare autoimmune disorder where your body actually attacks the cells in the pancreas that make insulin. In type 2 diabetes, there are many different types of medications that we can use to help the body use insulin more effectively so that blood sugar isn't out of control, or to help the body make more insulin. In type 1 diabetes, it's really an insulin deficiency where your body just isn't making the insulin. So we have to replace it with insulin injections, or some people may use an insulin pump.
Thank you, Michael, for that information and helping us differentiate the different types of diabetes. Can you tell us a little bit about programs and services available to diabetes patients at the Montefiore Medical Center?
Sure. So, I'm really glad to be part of this center where I do believe we offer comprehensive care. So that means you may see a physician, a nurse practitioner like myself. We have access to a psychologist, dietitians. There is a nationally recognized diabetes education program that really helps people take control of their diabetes. And beyond that, the Fleischer Institute for Diabetes and Metabolism here at Montefiore is very big into research. So we're really trying to meet the community where they are and provide a wide variety of services while also expanding diabetes care through further research.
And in relation to COVID-19 and diabetes, does a certain type of the ones you listed, type 1, type 2, increase your risk of severe illness from COVID-19? Which one of those is more at risk, and how should a patient take care of themselves during this time?
So in terms of how do you take care of yourself in terms of this time, I'd say I would give the same advice to anyone, whether they have type 1 diabetes, type 2 diabetes, or are otherwise healthy. Wear a mask, socially distance, wash your hands, be outside as much as you can when you're not able to wear a mask, and even mask wearing outside I think is recommended. So all these precautionary measures to prevent or avoid getting ill to begin with is our best bet. The data that we've seen really shows that having diabetes and other cardiac issues is not a good thing when it comes to COVID-19. People do much worse if they have diabetes, if they have heart disease, if they are overweight. All these play together and are related, and they just don't do nearly as well if they get sick with COVID-19. So, the other issue is to tease apart whether type 1 or type 2 is worse here. I would have a similar answer to if someone asked me, well, do I have the bad type of diabetes? I don't think there is a bad type of diabetes. I think you could live a very happy, long, healthy life with diabetes. the issue with the pandemic right now is that so many more people in general have type 2 diabetes. So the evidence that we see, the data that we see, is really coming from people with type 2 diabetes. I couldn't tell you that people with type 1 are off the hook. I don't believe that's the case.
Got it. Thank you for that. And what are some alternative diabetes treatments a patient can receive? We want to talk about CGMs and what that stands for, integration and insulin pens, and all these treatments that are available.
Sure. So ultimately, in diabetes, to effectively treat your blood sugar, we need to know what your blood sugar is. So years ago, patients, many years ago, patients would urinate on a certain type of dipstick, and it would be color coded, and you see, well, is my blood sugar low, high, or normal? Much more recently, they have pretty small and portable glucose monitoring devices where you have to do a finger stick. I don't know anyone who enjoys doing finger sticks. It is a needle to the finger. You have to draw a drop of blood and put it on a small stick, a small test strip, which is not easy. And you may have to do that multiple times per day. In more recent years, now you have continuous glucose monitors, which are wearable devices. You can wear them on the back of your arm. You can wear them on your abdomen. Really, anywhere there's a little bit of fat. There is also an implantable continuous glucose monitor. So you have different ways to wear this device, which is reading your blood sugar every few minutes over the course of the entire day. And if you compare that to doing a finger stick, which tells you what your blood sugar is at this moment in time, it doesn't tell you anything else, the continuous glucose monitor, or CGM, gives you much more data. It tells you what your blood sugar is at that moment. It gives you information about what direction it's going in and how quickly it's moving that direction, so you know if your blood sugar is rising, if it's falling, and if you need to take action to avoid a high blood sugar or low blood sugar. You can also generate reports and see what has your blood sugar been doing in response to food or response to exercise or any number of conditions, and really get a better sense of what works and what doesn't, so you can make the best decisions for yourself to treat your diabetes.
So when a patient goes into Montefiore, they have the option, a diabetes patient, they have an option between one or the other treatment. Is that the case with patients?
Not necessarily. I wish it was that easy. A lot of the times, insurance may dictate what patients are able to get. I'm a big proponent of diabetes technology myself. I think most diabetes tech, at least for the past few years, have been geared more towards people with type 1 diabetes, which really requires that you're on multiple daily shots of insulin or an insulin pump throughout the day. In type 1 diabetes, you can't use a lot of other medications that are available in type 2 diabetes. The benefit, or the one great thing about all these other medications that are available in type 2 is that so many of them now don't cause low blood sugar. So what we're really trying to do in type 1 diabetes is to control the blood sugar as tightly as possible without causing a lot of low blood sugar. And that's just that's a hard thing to do. So then you have the CGM come in, and it gives you so much more information to make these decisions. So with someone with type 1 diabetes, I really believe a CGM is a wonderful tool that they can use or have at their disposal. And yes, we will push for you to get that device if that's what you want. A lot of patients don't want to wear anything, and that's okay also. And we'll work with you where you are. It still requires a lot of finger sticks, though, to really get a sense of what's going on.
Thank you, Michael. And with technology surfacing and continuing to evolve, what types of technology are coming up next for diabetes patients? What is still needed to develop this technology or get this new technology?
So the last, say, couple of years, and even more recently the last 6 months and the last year, you've seen big improvements and big advances in how a continuous glucose monitor interacts with an insulin pump. And an insulin pump is a small wearable device that is usually attached with some tubing. Sometimes it's like a patch pump that you wear just on the back of your arm with no tubing at all. Everything exists right there on that device. But that is giving you insulin throughout the day. In the past, you had the pump that had its own program setting, delivering insulin to you at different rates throughout the day. And on top of that, the person with diabetes had to tell the pump how much insulin they needed for certain meals. There's a lot of math involved, a lot of interaction with the pump involved. Now you have the continuous glucose monitors talking to the pump. There are a couple on the market right now that do a pretty good job of really keeping the blood sugar in a target range and offloading the burden of living with diabetes. Again, in type 1 diabetes in particular, there is a lot of risk for low blood sugar. There's more risk for high blood sugar if you didn't dose your insulin properly. The advantages of a hybrid closed loop insulin pump is that you have these algorithms or programs on the pump talking to the monitor, making these decisions for you. It doesn't do everything for you, but it's really leaps and bounds past where we were a few years ago. So the pump companies are continuing to improve their programs to keep you in range more often, to reduce the frequency of low blood sugar and high blood sugar and reduce how severe those events are. The other issue that thankfully we deal with technology is most technology, as it advances, it's faster, it's smaller, it's more accurate. That's the direction all these are moving in. And we may have two connected pump and CGMs on the market now, there are others in the works and even more in the pipeline coming from other companies that are developing these products. And they all have the same goal in mind, to make your life with diabetes easier and offloading the burden of all those decisions that would go into living with diabetes every day.
Got it. Thank you, Michael, so much for your time today. And before we go, how can folks get in touch with Montefiore for more information on programs, treatments, etc., and just to learn how to live with diabetes during this time?
So I can give you one phone number is 866-MED-TALK. That's 866-633-8255. Or you can visit our website, montefiore.org/endocrinology.
Thank you very much, Michael Greenberg, nurse practitioner at Montefiore. Thank you.
Thank you very much. I do appreciate your time.
All right. Again, that number, it's 866-MED-TALK. It's 866-633-8255. You can also visit the website, as Michael gave us, montefiore.org/endocrinology for more information. We'll be right back.